Now that you know that bone is a living tissue, I wanted to explain a little bit about bone surface markings. Some of the anatomical terms that you are being asked to memorize in the bone labs are things like the deltoid tuberosity or the tibial tuberosity. And those are good examples of bone surface markings. Bone surface markings are not always present at birth, but those are areas of the bone where, um, where a muscle's tendon attaches, and like right here, right there, where a muscle's tendon attaches, and by constantly pulling on that area of the bone, the osteocytes that live in that part of the bone say, must make it stronger. And it brings in more osteoblasts that make it stronger. And you end up with bumps on the bone. Those are bone surface markings. So processes and outgrowths that are the result of tension from tendons and ligaments attaching there to the periosteum, that is evidence of the living quality that things that we think of as being, stable, like bones, actually have. Let's have a look here. I don't know if any of you have ever watched any of those police procedural dramas, dramas like NCI or CSI or Bones. If you've ever watched Bones, then you may have seen them look at a skeleton of a person who's died a long time ago and identify that person as being right-handed or left-handed, male or female, and maybe identify them as being very muscular or a couch potato. And you may have wondered, like, how would they know that stuff? Well, I am a long ways from being an expert in forensic osteology, which is that field, but I can tell you a little bit about how they know, and you can see it. So let's look at these two femurs right here, okay? This is the femur of a man who was 40 years old and very athletic, and actually was a weightlifter. And this is a man who's the same height, same age, same weight, but a couch potato. Now, how do we know? Well, you can see that these two bones do not look exactly alike. Yes, okay, in general, you've got the head, you've got the greater trochanter, you've got the lesser trochanter, but what is different? One thing that's different is this area here, that is the neck of the femur, and the neck of this femur is much thicker than the neck of that femur. That is one bit of evidence that this person on the left was holding heavy weights, like a weightlifter that's doing squats, right? But there's more. What are these little bumps here? Do you see those little bumps? Those are places where muscles attach. Now, this fellow, those muscles were attached there as well. But this fellow hardly used those muscles, so no bumps developed there. Whereas the guy on the left, he used those muscles a lot. And so those areas got to be big bumps as the osteocytes recognized, hey, he's really tugging on this area, called in more osteoblasts and built thicker bones. This is evidence of how weight-bearing exercise can make your bones thicker and stronger. But you actually have evidence that using bones makes them thicker and stronger right in front of you. I don't know if any of you ever wear a ring, but if you wear a ring, if it fits on, like this one fits on my ring finger on my left hand, but it won't fit on the ring finger of my right hand. Why not? It's because I'm right-handed. Now, you may assume that people who are right-handed have bigger right hands. Not by birth, okay? The reason that my right hand, that its bones are thicker, is because I'm right-handed. I use my right hand all the time. Since I use my right hand all the time, the osteocytes in these bones are like, well, here she is using us again to use scissors and write and grab doorknobs, and she's always using us. And so they made these bones thicker, and these bones are not used very much, so they have stayed small. If for some reason I wasn't able to use my right hand anymore, then I would start using my left hand more, and these bones would get thicker in comparison. So you can actually tell whether someone you're dealing with is left-handed or right-handed or ambidextrous by whether rings that fit on any of these fingers would fit on the opposite hand's fingers, right? I want you to know that a joint is an area where two bones meet. Okay. A joint is also known as an articulation. That's why the hyaline cartilage, right there where the two bones meet, gets called articular cartilage because it's a part of the joint. Joints also get called arthroses. There are three main types of joints, and you should know the three types and examples of them. They are the fibrous joints, cartilaginous joints, and synovial joints. Let's look at the three kinds. Fibrous joints. Fibrous joints have connective tissue masses of dense regular connective tissue attaching bones. Did you know that where this bone of my skull comes in contact with this bone of my skull, that technically that area where they came together was considered a joint? Yes, because a joint is an area where two bones meet. Now, up until you're in your 50s, these are actually individual bones up here. And they're joined by something called a suture. This one is the sagittal suture. You'll be learning those in week 5 in lab. You'll learn all the sutures of the skull. So that's a good example of a fibrous joint. Fibrous joints don't move very much at all. These don't move much at all. They do in babies though, right? Have any of you seen the head of a baby that was born through a regular vaginal delivery? Not a C-section. C-section babies have pretty heads. The heads of babies that have been delivered by natural childbirth have got these weird cone heads. And the reason they got weird cone heads is because these joints will move when babies are being born. And that's why they put those cute little hats on babies, is to keep people from freaking out about their heads. Also, the connection between the radius and the ulna, between the tibia and the fibula, those are also fibrous joints. Let's talk about cartilaginous joints. Cartilaginous joints will use a little bit of cartilage, very often fibrocartilage, to connect the two bones. So here we have got one vertebra, the body of a vertebra, and there's the next one above it. And at the end of this bone, there's some hyaline cartilage. At the end of this bone, there's some hyaline cartilage. But there in between them, there's a little chunk of fibrocartilage called an intervertebral disc in the case of your back. That little chunk of cartilage is one of the things that makes this a cartilaginous joint. It is not a synovial joint. It doesn't have the qualities of a synovial joint, but it does have this slice of cartilage, a disc of cartilage in between. Another cartilaginous joint is the pubic symphysis. Now, synovial joints. Is that the right way to spell movable? Huh. A synovial joint, whenever you think of a joint, you're probably thinking about a synovial joint. Synovial joints are very, very movable. Your shoulder is a synovial joint. Your fingers have synovial joints. Your wrist is a synovial joint. Your knee is a synovial joint. Okay, what's this thing with the synovial joint? Synovial joints have capsules around them, and the capsule, called the synovium, makes a slippery fluid that gets called synovial fluid or joint fluid, and that slippery fluid lubricates the articular cartilage surfaces between the two bones. So it is a specially lubricated joint cavity. These are very movable, and all of our joints that move a lot and move frequently have got a synovium. This is kind of like there's a part of the car that's got, is it the differential has got a boot around it that holds a real thick grease inside of it so that this one part of the car can keep working for really a long time. That's what a synovium is like. It's like a boot around the ends of the bones. It makes a slippery liquid, not technically oil, but when you feel it, it would feel like an oil. And that lubricates that joint. So synovial joints. You need to know the difference between a ligament and a tendon. Ligaments are dense regular connective tissue that attach a bone to another bone, okay? So for example, if I were, if I were to draw the knee. Okay, so here's the end of your femur, right? And here's the beginning of your tibia. Down inside of there, there is a ligament that attaches the back of the femur to the front of the tibia, and there's the one that attaches the front of the femur to the back of the tibia. And their job, is this right? Yeah, I don't know. Okay, their job is to keep the bones from being able to go like that. Attaching one bone to another bone, ligament. Okay, those are ligaments. On the sides of the knees, there are collateral ligaments. I mention knees because particularly people at your age, high school and college, they've got the most experience with injuries is going to be knee injuries, just statistically. Okay, so that's what ligaments are. Okay, then what is a tendon? Tendons attach a muscle to a bone. So at the end of the biceps muscle, it's going to get attached right there to your radius. And so attaching the muscle to the bone, that is going to be a ligament. Oh, I'm sorry, a tendon. Your Achilles tendon, right, attaches your calf muscles to your calcaneus, your heel bone, and that is also a tendon. So ligaments, tendons, make sure you know this difference. It is on exam 2. So there are additional slides in this slide deck that are just about osteology. I thought they were really interesting, so I was going to lecture on them, but you got enough to learn, okay? But if you're really interested in bones kind of stuff, then you might like the rest of the slides in this deck, okay? Now we're going on to, I think, the endocrine system. See you then.